Okay, good morning, everyone. So I'm taking the lead this time. My name is Muhammad Ali Jardali, for those who don't know. This is episode 108, Khalil.
108, yeah.
108, yeah. So I'm joined, as always, by Khalil. And we have a special guest today, Dr. Christopher Soujah. Christopher is a pharmacist and a Pharm-D candidate at both LAU and Houston Methodist University. And actually, we're talking about him because he was brave enough to post about his story on LinkedIn. And his journey really has been shaped by both resilience and determination. He balancing graduate school and Pharm-D is tough enough as it is, but he was also doing it while undergoing chemotherapy and radiation for Hodgkin's lymphoma, stage 3B. During that time, he was also working part time as a medical writer on top of everything else. So really, we wanted to talk about those experiences with Christopher, to learn more about his passion and how his journey is impacting his advocacy. And I'm sure it changed his perspective on healthcare and all of that. So yeah, I'll leave it to Christopher to introduce himself and take it from there.
Thank you, Muhammad, for the introduction, and thank you guys for having me. You said it mostly. Excited to be here. This is the first time I'm talking about my journey. This is the first time I'll be talking about what happened, my story. So let's go.
Yalla. Can you talk us about what were you when you first diagnosed? What were you feeling? How you processed the news and all of that?
Sure. So it all started back in December 2023. It was my last fall semester at LU. I started having a persistent cough, dyspnea, lost my endurance somehow, and started having weight loss. So I lost weight. This was December 2023. It was my last fall semester. Going into my last spring semester, 2024 January, the symptoms started to increase. I started to investigate them more or less, try to treat myself, which is wrong. Don't do that. Started to feel that, oh, okay, it's serious. It's more than that. It kept on increasing. So I kept on having the persistent cough, kept on feeling the same symptoms, lost my endurance. So I'm a basketball athlete. So every time I went out to play, had a match or something, I felt something's wrong. I started also having secretions, constant sputum, up until I started having night sweats. So it hit me. It basically hit me. I started having the B symptoms, the lymphoma symptoms. So this was still talking January. Started having the weight loss, night sweats up until April. Mid-April, I got the fever, and it wasn't a normal fever. So I had to go to the ER, and all that while I was still in university. So I didn't have that time, the luxury or the privilege to investigate it further. So up until the fever hit, and it wasn't a normal fever, an infectious fever. It was something really new. So I went to the ER, and it was April 15 back then, the day I was admitted, and it all started at that day. Uh, the normal tests you do in the ER, and then the process, you know how it goes. So I was diagnosed back then and started chemotherapy on May, to be exact, 9. Okay, so this was the whole process. I'm going to talk to you more. As I said, this is the first time I'm talking to going back into the timeline and everything. So May 9 was my first chemotherapy session. It's the day that I went to visit, put the chamber on, and it was the first day of admission was my first chemotherapy session. I had also at that time my finals. It was my last semester at LU, so I had my final exams to do, and I didn't want to do any makeups. I wanted to graduate with my colleagues. It was really, I felt it. It's like you're at the finish line and you want to pass it through. So my chemotherapy session was May 9. I still had like 4 final exams to do. and to graduate. So I finished my chemotherapy session, didn't know what to expect. Of course, as a pharmacist, you can know what to expect somehow, but you never really know. So I just leaned my focus on studying and going on for the exams without doing any makeups, finishing with my colleagues, and that's exactly what I did. So this was the timeline back in May. I finished my final exams. Yeah.
So when you were diagnosed, like what did you feel when they told you? Because probably a lot of us, one, you were in like pharmacy, right, which is like the medical specialty, so you know something about, or you know about this, which makes it maybe harder. And number two, we all think this is never going to happen to us. So what did you think when the diagnosis came at that time?
Yeah, that's a tough one. So I knew something was serious, something was wrong, not the usual stuff. I kind of expected it somehow, but you never really fully understand it and feel it up until I know I won't forget this. So basically from April 15, the day of my admission to the OR, up until May 9, I was in denial. So basically I didn't really I didn't feel like I had cancer. So when I went to the intervention radiology and put on my chamber, that that is when I realized, okay, so it's real. I have cancer. Uh, the day of my first chemotherapy session. So after I put on the chamber, my mom was next to me. She she's been she was with me all the time, and she saw me crying a little bit after I put on the chamber. So at that moment, she knew that I realized that it's real. So during the diagnosis and afterwards, you want the time to process it. So even as a healthcare expert, as a healthcare professional, as a pharmacist, it's kind of hard to fully grasp it up until it happens. So basically, that day it was hard. During the diagnosis, it was harder. When I got the real diagnosis, it was harder on my parents and my surrounding more than it was hard on me. So I wanted to keep a strong face, a strong personnel for everyone around me that I can make it through, even though it was really, I didn't know what to expect. So it hit me the day of my first chemotherapy session. And then I realized, okay, it's real. I have to think it through, process it slowly, alone, and know what to expect.
How was it getting diagnosed at the place where you work? Right? I mean, you did an internship at RISA, you know all those people. I mean, this is where you go to work, and now you're going in as a patient. Was it like dissociating? How did that experience feel like?
Okay, so I forgot to mention that. So I was diagnosed in Clinique de Leuven, the hospital of Leuven, but I had my chemotherapy and all the treatment in RISA. So I wasn't diagnosed there fully per se, but I chose, and thanks to LEU and all the efforts they did, it was possible for me to take the treatment at LAUMC-RH and continue my Pharm-D program at the same time. So they made it happen through a lot of efforts, through a lot of paperwork, a lot of logistics, so that I can be in a familiar place, know what to expect, have familiar faces around me, trust my surrounding, and trust that I'm receiving the best care possible. So they made me feel very welcome. They know that I've interned there. I know the place from A to Z. I know everyone around there. So they made it possible. So having this treatment in Rizit made it easier for me. Uh, I know the people. It felt like, okay, so I'm one of you guys, and I want to thank them really, the physicians, all the healthcare experts, the nurses, the pharmacists. They made it feel like I'm normal. They didn't make me feel like I had cancer, and that's all I wanted all throughout this year. So to be a regular guy, just treat me normally. So they made that possible. They took very good care of me, and even even at that time, they helped me throughout my Pharm-D degree. So I'll talk further into that later on if you want, guys.
So basically, I mean, it's hard, right? You're like getting diagnosed, you're close to your final exams, you haven't graduated. university. And so what were the biggest challenges you faced during treatment at that time, both physically and emotionally? And I'm sure, as you said, getting treated at RISA helped you out from that standpoint.
For sure, for sure. Okay, so physically, I was, let's say, fortunate enough that I got my first chemotherapy session on May 9, and my final exams were later the next week. So the chemotherapy didn't accumulate yet. So I was basically don't know what to expect, but it was not that hard on me at that time to make it possible to physically to attend the final exams. It was at that time just purely psychological, purely mental, purely emotional. So physically, I didn't feel the symptoms bombard me yet. So it was able for me to commute and to go to campus on campus and go through my final exams. I had 4 or 5 maybe to graduate, and that's exactly what I did. So my chemotherapy and my treatment regimen was basically 12 sessions. Every 2 weeks, I have a session. Okay. So my first one was on May 9. So I had 2 weeks up until the next one. I finished all my final exams between that period, and it went smoothly physically. Emotionally, I'm not gonna lie, it was a first. It was new. Even when I was taking the exams, I wasn't fully focused, which was hard. I wasn't fully able to, you know, I'm usually a person that enters an exam and knows everything. I make it my responsibility to know everything and know what to expect. Those exams, I tried to do that, but I wasn't feeling myself, which was somehow weird. But physically, I was fine. Emotionally and mentally, that was hard, the hard part. After my, let's say, after the exams, after I graduated, I started feeling physically everything you can expect to feel with chemotherapy and with the treatment. So physically, I was very weak. And that's the reality of it. I don't want to sugarcoat it. I try to work out. As I said, I go regularly to the gym. I'm a basketball athlete. I couldn't do that at that time. So basically, walking 5 meters, a walking distance, I found that hard. So I'm not gonna lie, physically, it was hectic when it kicked in, when the chemotherapy accumulated, when my regimen started working. So I felt weak, frail, and that is normal. But I was fortunate enough to keep myself emotionally and mentally busy. I had the final exams to prepare for. I did that, moved on to graduate with my colleagues in the best way possible. And afterwards, so I graduated, let's say in May and June. I'm starting my Pharm-D degree in beginning of September. So I had July and August. Everyone told me, okay, Chris, now it's time for you to relax. Don't pressure yourself. Don't push yourself. Be you. Just sit at home. Don't think about anything and relax. And that is what I did for 2 weeks between June and July. And it was the hardest thing that I ever did. Really, this is purely wrong. So I sat down 2 weeks, not pressuring myself. Everyone, everyone basically telling me, "Don't do anything. I'll help you. I'll help you out." Those were the toughest 2 to 3 weeks I faced because emotionally I wasn't keeping myself busy. I wasn't educating myself. I was purely just processing everything, waiting for something, waiting to feel something, thinking about it through, thinking about everything. So it was hard. And that is when I realized that is not the way to go under treatment. That is not the right way to process it and to fight cancer. Honestly, very honestly. So it hit me. No, I don't want to stay that way. Cognitively, I became very degrading, let's say, downgrading my mental abilities, lost focus, lost basically everything that I wanted to do, I couldn't because I was just relaxing and sitting. So I didn't like that. And I found this to be the hardest thing I've done. So I started thinking this is the time where I started processing everything I want to do, rethinking my priorities straight, setting my goals, my priorities and dreams, and educating myself always. So I finalized my CV at that time during these three weeks and started applying. I told my friends and my family that I'm applying to jobs. What are you doing? Why? Why? Why not rest? Is that the way to go? Just keep yourself relaxed, rest. It's not the time. And I didn't listen. Full on, I didn't listen. So I started applying to jobs, which I just take it briefly. I'm gonna mention that I worked part-time as a community pharmacist during my pharmacy degree, and it required me to be present there. So I knew it was hard and challenging to be physically present in a job. So I started applying to jobs that I need to experience something new, and I can fully give them what they expect. And this was purely remotely. I found it best to look for jobs remotely. So that is what I did. I applied to a job at that time, a medical writing position opened up, and I interviewed the business operation manager, and it went well. So, okay, I got a job, a real job. It's legit. Uh, I don't want any special treatment. Something new keeps me busy, takes my mind off of everything negative, and that is when I wanted to. So beginning of August, I started my part-time medical writing job, and this was one of the best decisions I made because July was the worst month I can expect because I did nothing basically that month. So this is not the way to fight cancer. Physically, as you asked me, physically and emotionally. So physically, it was really hard. Emotionally, I'd say you can manage that. And how you manage it really plays a role. So keeping yourself relaxed, doing nothing, I found it not the way to go. So, and it showed when I started my job, very enthusiastic. It gave me more than the job gave me more than I gave it, basically. I gave it my best, learned a lot on the job. An emerging position. Medical writing is booming. So I gained a lot of stuff, a lot of information, a lot of knowledge, and kept myself busy and educating myself constantly. So that is basically what I needed to keep my mind going, my mind off of things, growing mentally even at that time. So this was August basically, and this was at the beginning of the treatment, let's say.
Wallah, يعني it's a lot. يعني thanks for sharing all of that. Kudos to you. يعني يعطيك العافية. But yeah, it makes sense what you were saying. يعني you want something to be thinking of other than the cancer. Did you disclose your condition when you applied to the medical writing position, or you kept it to yourself?
Yeah, okay. So the interview I mentioned in my CV that I am a Hodgkin's lymphoma fighter. I put a sticker on top of the CV, and I mentioned it in the interview. And at the beginning of the interview, I told him, "Listen, I don't want any special treatment. Just consider me a regular guy. I will do the hours. I'll do the billables. Just consider me a regular guy. Treat me like any other employee." And that is truly what happened, basically. So I'm thankful for the company and the business operation manager. His name is Anthony. He gave me a chance. He gave a chance on me, even though he knew little of me. So he really helped me out, and I gave the job a lot of things, and I gained a lot of things throughout the job. And I want to mention something that here in Lebanon, it's still hard. And this is what I saw, what I realized, that when I got the diagnosis, when people started to know that okay, Chris has cancer, my friends or even people that know me but don't know me a lot, so they start looking at you in a different way, you know. They start seeing you as a different guy. It's like you're marked now. You're a marked person in the environment, in the community, and that is what I felt was weird. But I know I can't control it, and I can't expect other people's every person reacts and empathizes in a certain way. So I can't control how they do that, but it was hard. I saw the eyes, I saw everyone how they looked at me in a way, and after diagnosis, they looked at me in a different way. So this is what I was asking, just to be treated normally. And I started realizing that it's not them, it's me that should show them that, okay, I'm normal. And this started when I landed the job, and started when I started the Pharm-D program at RISE. And this is what I want to discuss next. So at first, people saw me in a different way up until my first day of Pharm-D, and it kept that way from then till now. So it's been from September 1 till now that I'm still finalizing my rotations here in RISE. And people saw me coming to the hospital day in, day out, not missing any day, coming to rounds, acting normally, being a normal pharmacist, undergoing chemotherapy. Okay, they started to wonder, no, what's wrong? Why is he here? Sorry.
عادي لبنان قطعت
I'm sorry. Exactly. So I expected that. That's why I'm. Yeah. So I was. Sorry, guys. So I was saying
عادي ما بحكي
that
عليك
I didn't
من
miss
20
any day.
سنة هيك.
Exactly. So sorry again, يلا. It's
رجعت
back.
صح.
رجعت. Okay, so I was saying that it was my responsibility to show people that I wanted to be treated normally, and I took that personal. So what I did is that, okay, I have the part-time job, flexible, remotely. It considered me to work 4 hours per day. So I did that at the afternoon when I'm done with my day at RISE, when I'm done with my rotations. So I came back home, okay, had lunch, relaxed a little bit, and started working. So my lifestyle was, for the past 4 or 5 months, was like this: go to RISE, get there in the morning, do my pre-rounds, do what's expected of me and more. Always kept up to date depending on which rotation I am in. And the residents, the physicians, the nurses, the doctors, they saw that. They saw me working as a typical Pharm-D candidate, doing what is asked of him or her. They saw me as if I'm just focusing on what I should do, and not a cancer patient, not someone who is being treated here. And I want to thank them all. Don't want to name, because literally everyone did that. They treated me normally. They really treated me normally, and that's all I wanted to. I asked them during my rotations to do. So this helped a lot.
Yeah. So basically, I think what you're saying is, I think people are like that everywhere. Like when they know that you have cancer, they feel they need to support you. They may feel bad for you, or we need to help him out and stuff like that. But then probably once they saw that you were overcoming this and uh, doing normal work and working hard and working normally, they started treating you more like a regular person because they saw that you were not as affected by the cancer. So my question for you is, how were you able to balance this between this and the work that you're doing? I mean, I know it's very psychologically, probably it's very hard to balance that, especially when also physically you may not be feeling very well with the therapies that you're getting.
Yeah, I agree. I'm not gonna lie, it was hard at the beginning, but when you adapt to a certain lifestyle, to a certain routine, it becomes easier. So at first I was like, okay, well, I'm tired physically and emotionally, and my time management is through the roof. So my schedule was full basically. So I said, okay, scrutinize it, digest it. You can do this. When they say that small wins matter a lot for cancer patients, I didn't. I just closed the door on this saying always. up until I did them, up until they became reality. So small wins do matter. They pick you up, they give you motivation, they give you the will to continue. So physically, as I said, I was weak all the time, fatigued, nauseous all the time. The nausea was crazy, but mentally I was focused. Um, this was hard. My schedule, as I said, was the same. Pharm-D, then work. Pharm-D, then work. And at first, this was physically tiring, especially waking up in the morning. I'm like, here we go again. And as I said, my treatment regimen was every 2 weeks. So I used to feel 10 to 12 days of pure symptoms, treatment related symptoms. And I got 2 days where, okay, I can rest. I'm feeling better. And then here we go again. So this up and down. So I got 2 days of ups and downs. But those 2 days, I took the time to process, reschedule, look at my schedule again, tweaked what I wanted to tweak. In that, I started to realize and note myself that at that time, I'm tired. Okay, I try to do something that doesn't require really so hard work. So I started to note and made the system basically. At the hospital, I was fully away, fully concentrated and focused.
In the zone.
So in the zone, perfectly said. I was in the zone, and of course on 4 cups of coffee, which was which were necessary, but it was worth it. And a requirement of my program is to fill the hours one, do the requirements of each rotations. So this was my number one priority, always my Pharm-D degree. Secondly, my work, and just to put it that way, which is wrong. Thirdly, my health, because as I said, when I was in July, I set my priorities straight that I want to graduate, I want to work, and then I want to know after graduation, after becoming a doctor of pharmacy, what do I want to do? So the time management was necessary. I wanted to, okay, the small wins were great, but I want the big wins. I started realizing, okay, I want to graduate, I want to work, I want to make it basically. So I couldn't miss any day of Pharm-D because I don't have the time to make it up, because I'm literally traveling next Saturday, and the program requires me to fill my hours. And if I don't do so, I don't graduate. And this is the tricky part. So I had to show up every day, which was actually, it was very nice. Even though I felt all the symptoms, or I felt tired, nauseous, it was really nice because it's the place I want to be. I see myself in a hospital. I see myself as a clinical pharmacist. So it took my mind off of things, and I used to care for patients actually. So I was doing what I love, even though I was a patient. So I don't know how to put it in that sense, but I really loved it. So I didn't consider it as work as much as I considered it as something I should do, regardless of work. So I realized, my work is afterwards. So getting back home, taking a break, having lunch, and then it hit. Okay, so I have still work to do. This required some adjustment. This required me to adapt, to stick to the routine. At first, it's hard, then you get used to it, and that's what I did. So this was it for how I juggled.
It shows the power of the mindset, really. Hearing you speak and share your story, it's all about the mindset. Like they always say that it's all about the mind, and you can control it in the mind. I can really see that with you. Like you are like controlling. It's a power game in your mind, right? You felt that?
Yeah, I felt okay. So the thoughts were always there. Several ideas all together. You don't know where to put them. The mind really does play a big role in that. But I want to emphasize on the fact that here, everyone that talked to me, they told me, okay, you're strong, you'll get over it. It's all in the mind. all throughout my treatment, all throughout my diagnosis. So everyone said, you'll get through it. ما بنخاف عليك، ما في خوف عليك، انت قوي، هي كلها براسك. I'm gonna say it in Arabic because I've heard it a million times. Okay, so I agree. There's a big part mentally. There's a big part mental, but that's not it. So it's also physical, it's also emotional, it's also mental, psychological. So it's a whole lot of things all at once. Mental is a great. It's okay. It keeps you going. It set yourself straight so that you can go through all of this while still being sane. I fully agree. But the treatment, I'm taking it. So it's a big part. Physically, it was draining, but I see what you're saying, that mentally because I was always busy, always educating myself, always in a routine, stuck to work, it got me off of those thoughts, those physical symptoms, and what I should normally feel. I fully agree, but there's always more than mental. So it's more than mental. The battle, the treatment, the fight, it's a lot of things all at once. I wish I could explain. When it comes to this, I'm basically very lost how to express it, because it's something I haven't experienced before. And the more you read, the more you see the guidelines, the more you see what I should do, what I should not do, especially as a healthcare expert, it's all literally patient specific. So I might be that way, another patient might see it in another way. So it's that after all. So just I want to emphasize on this fact.
So Christopher, can you tell us? So you were doing your rotations, you went through your therapy, and you're done now, right? You're done with the therapy. You're what we call in remission at this point.
Yes, basically now I'm in remission. October 25 was my last chemotherapy session. Waited 3 weeks, 4 weeks after that. Did the PET scan, showed that I'm in full remission. And then I had to undergo 15 sessions of radiotherapy. And December 13 was my last radiotherapy session. So this was my last day of treatment. So I've been
Look.
cancer-free and remission since then. Thank you.
Congratulations.
Oh, no time
I
to
mean,
get
it can
sick,
show
eh?
there's
You're going
back,
to
no?
Houston, خلاص.
Yeah. Yes, hopefully. Yeah, next Saturday.
Inshallah.
By the way, I just want to tell you, you finished your chemotherapy and you still have a lot more hair than Muhammad Ali Jardali.
Or Khalil Diab.
Whoa, okay, I did not expect that. Nice one.
Ya Allah.
So Christopher, one thing I wanted to ask you, how did this shape, like a lot of times people say, and I've heard it from cancer survivors and some other things too, maybe like even trauma survivors and stuff like that. So how is this shaping your outlook on life uh, and your future years? How would you think this will shape your future years and your outlook on life?
Great question.
Yes, I know.
It's I got shifted mentally. It's now my perspective through and about life is completely different, completely new. So I faced mortality and I got the second chance at life, basically, as simple as that. Every breath I take normally, I feel amazing. It's like a new chance. Every day I come back home, breathe normally, which I couldn't do for a year, basically. Go to the gym, do my regular daily activities. I feel lucky. So I was talking to a friend 2 or 3 weeks ago. I told him, yeah, I was lucky. Now I'm in remission. He told me, no, you're not lucky. You have guardian angels. And it hit me. I thought about it. I said, I mean, he's right. Yeah. So my perspective through life is this. It's like I'm reborn right now, like a phoenix reborn. I have a second chance, a new chance at life. I want to make the most out of it in everything I do. I want to live up to the highest expectations, use my full potential, and because literally I missed it. I don't want to cram. I don't want to be lazy. I don't want to do anything that keeps me from pursuing what I want to do, whether being health wise, career wise, business wise, uh, everything basically, every aspect of life. I just am focused on getting the most out of it, because when you're done, when you've been fighting and juggling and surviving throughout the year, and when you get the news that you're cancer free, it's the best feeling you can get. And after that, this is the real battle. How do you want to change your life? How do you want to live after that? And I decided basically on December 13, when I finished radiotherapy, and after November 12th, after I got the news that I'm cancer free, I decided that the last day of treatment, this will be the last day I struggle, let's say, willingly. So I decided that I want to live my life and do what I want to do, pursue what I want to pursue. Those priorities I set and goals I set at the first line, the first month of diagnosis. I want to go through them, and this is what I'm doing. This is what I'm following, and it's been great. Really, it triggers your mind, it tests you, and when you get through it, it shows you that every second of your life, you're lucky that you're a healthy one. You feel well, that's two, but there's more than that, and this is what I want to explore.
Yeah, you count your blessings for sure.
For sure.
And how do you think like this experience will shape your patient care and like professional wise, like as a Pharm-D, how will that change the way you talk to patients and treat patients and interact with them?
Yeah, exactly. So this is also a whole new perspective. So I was an intern at RISA before I was diagnosed, and I was a clinical pharmacy intern. I saw how it goes and everything. And after being a patient and also pursuing my clinical degree, which is Doctor of Pharmacy in Clinical Pharmacy, I saw how complex the healthcare system is, and I saw the integral and important role every healthcare expert has to offer in the hospital setting. And here I want to emphasize that I know what it's like to be a patient, and as well a pharmacist. So I was fortunate enough to have a team that also knew that valued every person and personnel in the hospital. And I won't take that for granted, because now every time I have every rotation I'm in, every patient I have, I'm gonna give him or her my full focus, my full potential, because I think in the back of my head, when that was me who took care of me. So each patient deserves the 100% effort, 100% potential, 100% focus, so that he or she can make it through, whether it's from the physician, from the pharmacist, from the nurse, from his or her surroundings. All of that matters. And now my perspective as a patient advocate is that every patient deserves the full package. There's no in between. So as a pharmacist, I'm going to go over and beyond, and I see it as a responsibility for me and for the patient, that the patient gets the best care possible, because I got that, and everyone should get that.
Yeah, so Christopher, it's like also you're discussing also the supportive environment that was present in the hospital and maybe outside the hospital to you. And I think that's one of the good things about Lebanon, I guess. There's so much like surrounding and support that no matter what the situation is, people still feel that. So my next question for you is, what are your next steps? And then what advice do you give people who have cancer, or even regular people on a daily basis? Because a lot of people keep complaining, right? Oh, it's a bad day, whatever. So what advice do you give these people, and what are your next steps?
Okay, so I'm going to start with my next step is to finish my Pharm-D degree, become a doctor of pharmacy. And this is where my goals are set straight. I'm applying to residency, so to pursue a clinical pharmacy degree, become a resident, still in the process of doing so. This is my number one priority, where I see myself after finalizing my degree, my doctorate degree. Hopefully it works out, because I'm giving it a lot of time, a lot of effort. I'm giving it my all, basically, especially with the preps and everything. So this is where I see myself, and this is my goal dash dream, which I'm working on. But right now, my whole focus is on going to Houston next Saturday, starting my rotations there, get the best of the experience. It's my first time in the US. It will be my first time in the US. Get to know the culture, experience something new. I'm really looking forward to it. Really interested. Experience a new culture, a new perspective, maybe to healthcare. I'm always in pursuit of new things, new knowledge, learning. So that's my priority there. Advice I would give to anyone struggling is processing it alone first. What's the challenge? What's the struggle? Internally process it and reflect it on how you want to overcome it. Each person reacts and thinks in a different way, and that's the beauty of life, the diversity and so on. But I'd say just give it time to process it fully, scrutinize it, dissect it very well, and then put some goals, some things you want to accomplish, and try to do so with a schedule. Okay, so there's no time frame for that, especially for cancer patients. I maybe expedited a lot of things and went crazy some places. It wasn't always easy. There were days where I really found it hard and struggled mentally and physically and emotionally. I mentioned them briefly, but the advice I would truly give is that hold on to where you want to be, because when you have the end in mind, when you have your end in mind, you'll get through it, because you want to accomplish that. You want to be there. So your whole focus would be, I want to be there. I want to do that. I want to do this. I want to overcome that, and then go on to this. So you always have something to live on for. You always have some motivation to go on, and that's important, basically. This is what kept me sane. This is what also kept my surroundings, my family, my friends, everyone around me looked at me and know how. And I saw that sometimes, and I loved it, because when they said that, they realized that I'm normal. So they saw that I have my goals set and my priorities straight. So I want to pursue that. It won't be easy, especially for cancer patients. And just by the way, each cancer is not one size fits all. It's not one type. I'm talking about my experience. Maybe it's harder, maybe it's easier than some other experiences. So you can't generalize it. This is a mistake. And I realized that is every person should okay, now as I'm talking about what I did. I read it. It was hard for me because I'm in the field. At first, during the diagnosis, I knew what to expect. Maybe someone that's not in the field, just do what is necessary for you to keep going. Okay, so I don't know how to put it in that way, but find yourself through it and don't lose yourself. That's all I want to say, if that's understandable.
Yeah, it makes sense. And I think something that I picked up from this conversation is there's a very thin line between empathy and pity, but what you really want is people's respect. And I feel like you really worked hard to get that. I hope You got it. And I hope we portrayed that with the interview today. يعني. I'm really in awe of your determination صراحة يعني.
Yeah, Christopher, it
Thank
was,
you,
I
thank you,
mean, this
Muhammad.
was a, keep going. Yeah, Christopher, go ahead.
Yeah, I just wanted to thank Muhammad, and really, this wasn't my purpose, but this wasn't my goal to. I wanted to be selfish for once, just prove to myself that I can go through it. Sometimes I was over selfish. I didn't reach out. I didn't express my emotions, and this buildup was hard. So I just wanted to be selfish for once, and being selfish in that way is really helpful. So what I want to say is that my profession is about being selfless, but sometimes you should be selfish about your health, about your psychological state and mental health. So this is where I think I learned how and where to be selfish. And this was hard for me because I never thought of it in that way. And this is the first time I did that on my own, basically. So I learned there's that aspect of me which I now know of.
Christopher, thanks a lot for being on the podcast and for sharing with everyone your story. I mean, you've faced a lot, but also hopefully it's a lesson for people on how to be resilient, how to face your fears, right? Face your fears and keep going. And I think what I get from you and what probably Muhammad Ali gets from you is that one is resilience, number two is positive outlook on life, number three is keep going no matter the situation. And I think just be thankful every day for every day that you have in life. Be thankful for that day, and I think that's what people should get out of this.
Yeah, hopefully this is the message I want to send. Yeah, you said it perfectly.
Thank you.